exam candidates for today.
Yes.
Can you confirm your name and age for me, please?
I am Miss Annie. I'm 22 years old.
Nice to meet you, Miss Annie. Okay. What seems to be the problem today?
No, it is I prepare for my wedding. So when I try dress, one of my close friends noticed a swelling in my right side of the neck.
Sorry to hear that. Yeah. Okay. Is it you first noticed that just at your wedding?
Say again?
You just noticed that then, or you noticed it before?
No, no, it is just discover accidental. I just noticed that
Okay. When this happened?
1 week ago.
Okay. Is it getting bigger or getting worse since then?
No, it's a little because it is just within 1 week.
Okay. Is there any pain associated with it?
No, it is painless.
Is it tender to touch or something?
No, not tender, not tender.
Is there any redness around it?
No, no skin change.
Do you have any difficulty in swallowing or breathing?
No difficult to swallow, no difficult in breathing.
Okay. No changes in your voice?
No change in my voice.
Okay. How has your health been recently? Are you feeling well in yourself?
Yeah, I'm okay.
Okay. Have you noticed any unintentional weight loss?
No,
Have you had any fever?
no fever.
Do you feel your heart racing?
No,
Any change of your appetite?
no,
Have you noticed that your hands are like shaky?
no tremors.
Okay. You have any mood changes recently?
No,
Any change to your bowel habits? Any diarrhea?
no, no,
Any problems with your menstruation?
no irregular menstruation. It is normal.
Okay. You feel any increased sensitivity to heat?
No, normal tolerance to heat.
Okay. Are there any changes in to your vision or the shape of your eyes?
No eye change.
Any sleep disturbances?
No sleep disturbance.
Okay. Have were you diagnosed with any medical conditions in the past,
Like what?
like diabetes, hypertension?
No.
You take any regular medications?
No.
You have any allergies
Allergic to what?
to food, like to some food or drugs?
Allergic to seafood.
Okay. Have you ever been admitted to hospital before?
No.
You have had any surgeries in the past?
No.
Has anyone in your family been diagnosed with any medical problem?
No, but my aunt have the swelling in the thyroid also.
Okay. I need to ask you some personal questions. Do you
Okay, can.
smoke?
Yeah, I smoke 5 cigarettes per day for the last 3 years.
Do you drink alcohol?
Yes, I drink alcohol occasionally.
How about your diet, your level of activity? Do you live a
Uh,
healthy
uh,
lifestyle?
yes,
Okay. What do you do for a living?
I am a student.
Do you live near near the sea or away from the sea?
No, I live in desert. I live no sea in my country.
Okay. Who do you have
All right.
at home with you?
It is my dad, my mother, and two children, two brothers.
Have you traveled anywhere recently?
I travel to India.
Okay, thank you, Miss Annie.
All right.
Anyone,
Uh,
anything else you want me to know?
no, thank you. So you take about 6 minutes exactly. So it is good. I just
Okay.
review your notes. So, of course, you introduce yourself. Everything is done okay. You ask about pressure symptom like dysphagia, dyspnea, hoarse no voice. You ask about toxic manifestation like nervous irritability, palpitation, myopathy, menstrual disturbance, GIT disturbance, eye manifestation. You need to ask also about any hypothyroid manifestation like loss
All
of
the
eyebrow
intolerance.
hair or
Mm.
hot intolerance. Yes, you ask hot intolerance, okay. And you need to ask about like easy fatigability, apathetic, so signs of
Hypo.
hypothyroidism, okay.
Okay.
This is
Okay.
first, but as a swelling, you need to ask about the size, shape, all this. So you ask, you don't concentrate about the size. So you need to first, you need to confirm it is a thyroid. So you need to
Okay.
tell this is in the lower and move up with the swallowing. So you need to ask about this move up with the swallowing. So after that, you can go to through the history of the thyroid. And of
Okay.
course, you ask about tender. Why you ask about tender? If it is tender, what it means?
If like thyroiditis.
Thyroiditis or Hashimoto, usually in thyroiditis, which is rare, it be tender, no problem. So you need to ask about the skin manifestation. You ask about skin manifestation, but you need to confirm it is the lower part of the neck and move up and down with swallowing. Okay, so what is
Okay.
your diagnosis?
طب sorry دكتور how can يعني what's the question for the size يعني how I can ask
What
the
is the
question for
exact
the
site?
size.
It is lower part of my neck. It is move up with swallowing. Yes, move up and down with swallowing. عشان تبتدي
size
تسأل بقى بعد كده
size
ثيرويد. افرض كانت ليمف
اه
نود او بتاع اللي هي برانكال
او
سيست او
تنسل
اي حاجه. لا،
تمام.
تونسل ده حاجه تانية. تونسل مش هتبان في النك، ما تقلقش. تمام.
طيب ماشي.
All right.
تمام.
Okay. So you ask about eye manifestation. What is your diagnosis?
Okay, my diagnosis will be simple nodular goiter.
Right side simple nodular goiter. Okay.
Right
So
side.
when you ask, I tell you that my aunt have a thyroid. So what is the cause of that? Her aunt have
Um,
goiter also. Why?
because they live away
Now forget
from
the
the
sea.
sea.
It is just lack of the
Okay.
iodine. You can live away from the sea and eat fish or salted
Yes,
iodine, not a problem.
but she
But
is
maybe
allergic
in,
to fish. Okay.
not allergic, nothing. It is just means that
Okay.
they have lack of iodine, so they have goiter. All right,
Okay.
okay. I
Okay.
just ask you because sometimes this topic come in pathology also. What is type of the thyroid tumor you know? If I say this patient have a family history of thyroid cancer, which type of thyroid
Yes.
cancer can run in family?
Will be medullary thyroid carcinoma.
Okay, is any type of the thyroid cancer have tumor marker?
Medullary calcitonin.
Calcitonin. Okay, so what is if it is autosomal? It is like autosomal dominant disease. So what is this syndrome called? If run in
Um,
family, what is multiple endocrine neoplasm type 2? What is have? Medullary thyroid carcinoma. What else?
also medullary thyroid carcinoma and bit- um,
Pheochromocytoma and
pheochromocytoma, right?
parathyroid adenoma.
And
Okay.
parathyroid adenoma, right?
What is the tumor marker of pheochromocytoma?
Mean to, um, I forget it.
No, it is metformin and in urine become phenyl mandelic acid. We don't ask this
Viral
in
mandelic
history. It
acid.
is just in pathology.
Okay,
Okay.
okay,
All right. If
okay.
this patient is 20 or 25 years old and have a cancer, what is the type of cancer they have?
Papillary thyroid carcinoma.
Papillary thyroid carcinoma. Okay. What is it is look like? I show you the picture. This is what is look like. Papillary thyroid carcinoma is look like that. Like empty cell and samoma body.
Samoma was right.
Sometimes they called it orphan Annie syndrome. Okay. What other type of thyroid cancer you know?
Follicular thyroid carcinoma.
Spread
And
by
also we
what?
said
Follicular spread by
by
what?
blood, by
By
blood,
blood. Papillary spread to
lymph nodes.
lymphatic, and anaplastic medullary can be all together. Okay, you can see this formal picture of follicular can spread to the skull. All right. What is the
Yes.
investigation you'll do for this patient?
For this patient, I will do a
For thyroid
table
patient, this
assessment.
thyroid patient, what you will do?
Okay, I will do a full clinical examination, ultrasound imaging, and fine needle aspiration cytology.
No,
Cytology. I may
doctor.
also
When you start by lab investigation. What lab investigation you will start?
I will order TSH, T4, T3.
Doctor, are you working army?
No.
So why you ask? I will order.
Okay. Okay.
I will ask for what
I will
test you
ask
need to
for.
do. What you need to do.
I need to do TSH, T3, T4,
Thyroid function test, T3,
thyroid function
T4,
test.
TSH, thyroid function test, blood
Also
investigation,
complete blood
baseline.
count.
What else?
Complete blood count.
Oh,
Calcitonin,
calcitonin
lymphocyte segmentation
sometimes.
rate.
Okay. What is the imaging you need to do?
I need to do an ultrasound, neck ultrasound.
Neck looking for what?
Looking for both for thyroids.
Okay.
For the thyroid
Nature of
gland.
the thyroid gland, if it is cystic or
Yes.
solid. If it's cystic, what next you will do?
A fine needle aspiration cytology.
Okay, and looking for the lymph node. Doctor, when you speak, is better when you answer the exam question, because all of you know the question, all you know the answer. So you need to tell like this. So first, I will ask for thyroid function test, which is T3, T4, TSH. I can ask other baseline blood investigation. If I query cancer, I can ask for calcitonin or thyroglobulin antibody. If I query something else, I will do or ask for ultrasound for the neck. If it is cystic, I will ask for fine needle aspirated cytology, and of course looking for the lymph node and others. Okay, so don't let the examiner ask you. If the examiner asks you, it is against you, not with you, because you maybe not understand our language, or we waste the time for that. Okay.
Okay. Okay.
All
Okay.
right.
Okay.
Thank you. I think you are better than previous time. All right.
Okay.
Thank you,
Thank you.
Dr. Muhammad Ghunim.
Thank you,
Anyone have
Dr.
a
Sharif.
comment or anything? Okay. I think now I will ask George, because George, I will give you the scenario you have an exam, and we just see what is what happened to you. So you mentioned that you have I just tell you what is written in the script first.
Okay.
I share it. So what is usually written is like this. 50 years old woman has been diagnosed with chronic cholecystitis. She is in pre-operative assessment clinic. She had a history of intermittent episode of shortening of breath or breathless for 10 years. Take a history from the patient. Okay, so you can see now we don't mention examine the patient. We just take a history.
Okay.
All right. By the way, if this need to examine, so this station not become under history taken, is become under surgical pathology, surgical physiology, or critical care. All right.
Okay.
So you can start.
Hello, my name is Dr. George. I'm one of the surgical
Yes.
team. May I
Okay.
have your name and age, please?
I am Miss Annie, and I am 50 years old.
Hello, Mrs. Annie. Nice to meet you today.
Okay.
How can I help you, Mrs. Annie?
I have shortening of breath for the last 10 years. So I came today because I have appointment for the elective laparoscopic cholecystectomy to remove my gallbladder.
Okay, I'm so sorry for this. Okay, and can you please tell me when this is started?
10 years ago. What you mean, the gallbladder or the shortening of breath?
No, I mean the shortness of breath.
10 years ago.
Okay. And was it increasing or decreasing or the same?
No, it is frequent, is according seasonal. It is, for example, in the spring it's become more, in the other seasons it become less. So it's different from time to time according. It is seasonal variation.
Okay, and during the day, have you noticed anything making this shortness of breath worse or better?
No, if I exposed to any dust or something from the garden, sometimes I have, not always, but sometimes.
Are you allergic to certain materials?
No, I allergic. If you go to gardening and they cut the grass, so sometimes I have this allergy.
Okay. And have you noticed any increasing in intensity during this period, or was it the same?
What you mean increase intensity? What you mean?
Like the shortness of breath becoming worse by days.
What you mean becoming worse?
More frequent during the day.
You mean the duration?
Yes.
Okay, it is take about 10, maximum 20 minutes. I
Okay.
think the longest one is half an hour.
Okay. And
Okay.
have you experienced the fever or cough before?
No fever, no cough.
Okay. Have you noticed any sputum or wheezes or sounds during respiration?
Sputum, you mean secretion? No secretion. What else? What you need to ask again? What else you ask?
Wheezes, like sounds during respiration.
No,
Okay. Have you noticed any unintentional weight loss
no,
or loss of appetite?
no.
Okay. Have you experienced any deep venous thrombosis in your legs before?
You mean swelling leg or thrombosis in the leg? No. But
Yes.
okay, all right. But doctor, okay, go on, go on. What else?
Okay. And have you
Mm.
experienced any shortness of breath, especially on lying flat?
Yes. No.
I have
You mean
experienced.
at time of sleep, I don't have dyspnea, and also if you mean that after 2 hours of sleeping, so also I don't have this.
Okay. And have you
Mhm.
experienced any chest pain?
No, no chest pain.
Okay, that's
No,
good.
no, I have chest pain, yes.
You have chest pain.
Yeah, I have chest pain.
Okay.
Mhm.
And do you have any other medical problem, Mrs. N?
No, if you have chest pain, you need to analyze the chest pain.
Okay.
Okay?
And where
Yes.
exactly does this pain?
No, no, it is just in my chest. What else you need to ask?
And when it started?
It is 2 weeks ago.
And does that the pain goes anywhere else?
Not radiated. Okay, thank
Oh,
you. All
okay.
right.
And do you have any other medical problems?
Like what?
Like diabetes, hypertension,
No,
other than the inflammation in your gallbladder?
no,
Okay. And are you taking any medications?
no. Just I take spray at time of the have attack.
Okay. And have you had
Okay.
any surgeries before?
No surgery.
Okay. Do you have any certain allergies against certain drugs?
No allergy to any medication.
Okay. And what do you do for living, Mrs. N?
I am a housewife.
Okay. And do you have any problems with climbing stairs?
No.
Okay. And do you smoke?
Yes, I smoke 5 cigarettes per day for the last 10 years.
Okay. Do you drink alcohol?
Yes, I drink alcohol occasionally in weekend.
Okay. And uh, is something you are concerned about this shortness of breath?
No, I used for that, so no problem.
Okay. And let me ask you some questions about other systems. Do you have any problems with eating or swallowing?
No,
Do you have any diarrhea or constipation?
no,
Do you have any muscles pain or joint pain?
no,
Do you have any problems with urination or micturition?
no,
Okay, Mrs. Ann, do you want to ask me anything about?
no, thank you so much.
Thank you.
All right. انت اخذت 6 دقائق بس what I surprise I need to stop you but you make your mind again this is a problem is mainly in respiration. So
Mm,
you need to ask about shorting of breath, you need to ask about orthopnea, you need to ask about wake up from sleeping because this is characteristic of the dyspnea. Apart
okay.
from asthma, because when you start, if any patient in the cardiology or in chest, you need to ask about, I have dyspnea, you have dyspnea in sleeping, you have orthopnea. you have proximal nocturnal dyspnea. So this is very important. I just come through the question. So of course, after introduction and all this, how you need to you ask about severity. You ask me many times about severity. We don't ask like this. We ask about duration. So it is 10 minutes, 20 minutes. So if it is longer, it is severe. How frequent is occur once per week, seasonal, something like that. Sleeping well, nocturnal dyspnea, you ask. You need to make a link between the association between the gallbladder and this bronchial asthma. So is any association if the condition become worse after you diagnose as chronic cholecystitis? Of course, no much relation. So it is important to make a link about this. When I ask you, you ask me about chest pain. So I say yes, although I am hesitated. So you come directly, you can ask, is radiated to the left arm? If I say no, so it is not a cardiac problem. Okay. Of course, difficult to swallow. You ask fever. You ask about DVT, but I don't know why you ask about DVT. Maybe DVT is many medical term. Just ask if you have any clot or thrombosis in your leg, or you take aspirin, you take blood thinner, but is okay. You ask about marriage. You ask about okay. So it is important if the patient have chronic condition. What you need to ask, of course, this patient have 10 years condition, which is whatever the problem. So you expect is that within these 10 years, she went to GP or not?
Of course, John.
Okay, so what is the next question? You ask here, okay, of course you went to GP. So what is the GP? Ask me. Ask me.
What does GB told you or ask?
Okay, actually, GB make me a lot of investigation. He make a sputum analysis. He asked for chest X-ray. I stop here. So what is you supposed to ask me?
Did he give you medications?
No. What is the result?
What the results? Okay.
Okay, so the doctor and also ECG, the doctor say everything is normal. The blood test, the chest X-ray is normal. Okay. All right. So it is important if the patient have something chronic or something related. Of course, you ask about other system, asking related. So you need to ask directly what is done. Of course, 10 years he must go to the GP. So investigation is done. So now, what's your diagnosis?
Shortness of breath related due to stress for her impending operation.
Can be stress, but what is this condition? Before these have gallbladder 1 year ago, 2 years ago, but they have this condition 10 years ago. So what is this condition 10 years ago?
Anxiety.
No, it's actually it is a station of anxiety, but the diagnosis is not anxiety. This patient is not in anxiety in 10 years. What's this condition?
Bronchial asthma.
Bronchial asthma, جماعة. He is bronchial asthma. He is bronchial asthma. He of course he have some sort of anxiety. I write it is anxiety by the way. يعني أنا لو جيت في الأول كده هي shortening of breath in anxious patient. The patient is in anxiety, but the condition is bronchial asthma. Okay, so suppose you see this patient for many years ago, not now. What is the investigation you will do?
I will repeat the cardiac investigations as the ECG and chest X-ray again.
Yes. Any specific test for the chest evaluation?
I think VQ mismatch, but you told us that
no, VQ is much is historical, is not done nowadays. Ventilation perfusion matching is done by radioactive isotope. So now we have a lot of modalities, but at least you do respiratory function test. Okay, if this station is physiology station, he asks you to draw the respiratory function test, but in history taken we don't ask that. Okay, in the physiology also he show you the chest X-ray, so that's it. All right. So this is patient is just have an anxiety, but she's already have bronchial asthma. Okay.
Okay.
In the exam, what happened to you in exam? What is the response?
No, in my exam, I wasn't questioning those questions at all. يعني انا ما جمعتش اللجنه خالص.
اوكي. يعني هي برضو even if you don't know the topics, suppose I ask you history of something you don't have any idea about it, but at least if you ask about allergy, ask about smoking, ask about family history, ask about admission, all this is very important.
Okay.
It is important because you and the previous candidate, when you ask about any chronic illness, you need to enumerate. Like if you have any hypertension, diabetes, if patient is young, you can ask about bronchial asthma. All right.
Okay.
What is the response of examiner?
He was telling me that you are confused. You are still confused. كده.
اوكي، ولا يهمك، مفيش مشاكل، ان شاء الله خير. دكتور زهرة عايز تسأل، ولا دكتور زهرة ودكتور مرسليمو ملك؟ انتوا عايزين
ازي
تسألوا؟
حضرتك يا دكتور شني؟
اهلا
لا انا
بيك.
عايز اخد ستيشن بتاعه الهيدك.
ده انا
تمام.
كان عندي سؤال يا
هو
دكتور بعد اذنك معلش.
اسأل يا دكتور.
هو كنت بس حضرتك على البرزنتيشن اللي حضرتك بنشتغل منها، هل احنا في مثلا ممكن حضرتك تشيرها معانا ولا حاجه، بحيث ان احنا نعرف المين بوينتس
اللي هي
في
الباوربوينت.
الهيستوري الباوربوينت؟
اوكي، مفيش مشاكل، بس هي الفكرة برضو احنا عايزين نوصلك حاجة. انت مش بتمتحن في الايتم، انت بتمتحن في الهيدنج.
ما هو
يعني يو جيت ذا بوينت. يعني ايه؟ يعني انت لو جبنا الهيستوري في الاخر، يعني انا في تمبلت ممكن احط لكم التمبلت بتاعت الهيستوري تيكينج. التمبلت دي انت مش مهم اللي بيحصل ايه، انت بتركز على الدياجنوزس والديفرنشال دياجنوزس. And this is not the aim for the history taking. This is from the background in Egypt. They have history for inguinal hernia, history of appendix, history of something. You know these sheets. In England and in exam we have one template. انا شيرت معاكم النهارده الاوسكي باس كارد اللي هو الجنرال، اعتقد في حاجات كده، وممكن نشير الباقي، لكن انت مش انت لازم تقول دي ودي ودي ودي. you get the point ولا؟
I get the point، بس يعني الحاجات دي لو في حاجات بوينتس وقعت مني في الديفرنشال دايجنوز، او في حاجات انا ما سالتش
لا،
عليها.
هو احنا ما سالناكش في الديفرنشال دايجنوز. انتوا برضو يا جماعه عندكم اعتقاد ان انت في الهيستوري هتعرف الدايجنوزس. ده صعب. انت الهيلث وانت to know the diagnosis you must have investigation.
اوكي.
لو الديagnosis from the beginning is straightforward like acute pancreatitis, you don't need to ask about other differential diagnosis. But in discussion, if you ask what is apart from usually we ask you apart from this case, what for example if the case of appendix. So apart from this condition, what other differential diagnosis of pain of the right iliac fossa? So can be Crohn's disease, can be right ureteric colic. So this is for discussion, but not for history taken from the patient. واضحة؟ هنتكلم في الآخر لو حد عايز. دكتور زهرة
أنا
ودكتور
ممكن أسأل سؤال يا دكتور؟ هو
اسأل.
بالنسبة
دكتور شيرين
للعيان،
قصده
زي مثلا العيان ده كان عندها anxiety وكان عندها shortness of breath، فهل should I offer oxygen ولا لأ؟
اوكي. هتقول لي ازاي؟ قول لي يعني هتقول ايه؟
لا يعني I will ask the examiner if there is an oxygen mask to be placed on the patient ولا لأ؟
لا، في الهيستوري تيكن في الستيشن دي عايز تساله اساله، بس هي مالهاش درجه. لكن في نفس الستيشن بتاعه السيرجيكال فيسيولوجي اللي انتم معتقدين انها هيستوري تيكن بس هي مش هيستوري تيكن، انت لازم بتحط الماسك وبتظبط الاكسجين.
تمام. اوكي.
بتظبطه على كام بقى؟
على الفلوميتر يعني؟
ان هو على 4 لترز
5 لتر يا بيه، 5
من
لتر.
3 ل 5 من 3 ل 5 لتر. هو طبعا هو هيكلي مش شغال، بس انت بتظبطه. دي اللجنه دي اللي انت بتقول عليها دي مش هيستوري تيكنج. هي الناس كلها حطها في الهيستوري تيكنج، حتى انا حطيتها مع الهيستوري تيكنج عشان انتم معتقدين كده. دي لجنه سيرجيكال فيسيولوجي. اوكي. دي بقى هتحط الماسك، وممكن تسال على البلس اوكسيمتر، وهتلاقي الماسك موجود. يعني انت
تمام.
هتلاقي الماسك، انت هتلاقي ماسك وهتحطه، ولو المستشفى مجهزه هتفتح الاكسجين، لو مش مجهزه هتفتح برضو الاكسجين، وهو يقول لك هتدي كام لتر بير مينيت، هتقول له 5 لتر، واي فولو اب باي بالس اوكسيمتر اند اول ذيس. لكن انت في الهيستوري تيكنج نوت اوفر ات از هيستوري تيكنج. لكن لو نفس اللجنه بتاع شورتنج بريس، وفي لجنه كده، دي انت بتحط اكسجين وبتشوف الاير واي وبتشوف البريسنج وبتسمع العيانه وبتفحص صدرها وكل حاجه.
اكزامينيشن دي يعني قصد حضرتك
والله
يعني
ما
بي سي؟
examination, it is not an examination station. This is
يعني
بص يا
نولج
دكتور،
نولج
انا هقول لك انا حاجه. انت لو بصيت للهيدنج هنا، هشيرها تاني. لو بصيت للهيدنج هنا، this is patient in pre-operative assessment clinic.
اوكي.
هو مين اللي في البري اوبرتيف اسسمنت كلينيك ده؟
سيرجن.
لا
نايب يعني، نايب او كده.
لا مش نائب، ده
جراحة.
بتاع الانستيزيا. دي اللي هي
انستيزيا.
الاسسمنت كلينيك. ممكن يبقى سيرجن بس عاده بيبقى انستيزيا عشان تو ايفالويتد. سو ذيس ستيشن ناو ات از لايك، يعني ممكن تبقى تخش على الفسيولوجي. ما هي الراجل، انت تخيل نفسك بقى you are the anesthetist or the houseman in pre-admission clinic. ما انت
اوكي.
في ايتم في الهيستوري، في ايتم في الاكزامينيشن، وبيشوف الانفستيجيشن. في in England we have something called admission clinic or pre-admission clinic. Pre-admission clinic, or patient already has operation tomorrow and he knows that he have an operation, but someone clerk him and evaluate him. So evaluate him in 9 minutes. You need to ask simple history. You examine the chest or heart according to the condition. You're looking for ECG, chest X-ray, blood gases.
تمام.
بس للاسف ان الناس كلها معتقده ان this is history taken station. It is not history taken station. It is surgical knowledge or basic surgical knowledge station. It is
طب
under
سؤال تاني يا
histology.
دكتور معلش،
اسال.
في نفس الستيشن دي if the patient is
تمام.
يعني she will get admitted for an elective surgery, should we
Yes.
proceed with the surgery ولا
You proceed with the surgery. Bronchial asthma is not that dangerous. Anxiety is not that dangerous. So you can proceed no problem. برضو ده هو مش هيسألك في الموضوع ده. It is just history taken. It is not a communication skills.
تمام يا دكتور.
اوكي. دكتور زهرة، هنشوف السيناريو اللي بعد كده. اعتقد هو هيدك ده بسيط ده. اوكي.
تمام يا
اوكي.
بيه.
I share the screen. I just see what happened. Okay. I count the time for you, but we don't start yet. It's 25 years old man, suddenly have severe headache and coma 10 days ago. Now he's improved by treatment. Okay. So he's young, have a coma, now improved by treatment. Okay.
اوكي.
All right. So we can start. Okay. Okay, so this patient have coma, improved from the coma after 10 days. I think you are muted or what, Dr. Zahra, or absent or what? Are you here? Oh, I think he pushed a wrong button or something.
ممكن الكونكشن.
Make the connection. Okay. All right.
طب اخد مكانه لغايه لما يجي ولا؟
Can no problem.
Okay.
Okay.
All
right.
Should I start?
So, yeah, you can start. Yes.
Okay, doctor. My name is Dr. Muhammad Hisham. I'm one of the surgical candidates for today. May I just confirm your name and age?
Yeah, I am Mr. John. I'm 25 years old.
Okay, I was asked to take a brief history. And what seems to be the issue?
Okay, Dr. Zahra, we leave you to the next station. It is also related to the condition. All right. So what you need to ask? I have a coma 10 days ago.
Okay. Was it preceded by anything?
What you
Before
mean
you entered
preceded
the
by
coma,
anything?
did anything happen? Did you have a severe headache?
You mean early warning sign or something? I have severe
Yeah.
headache, and suddenly I don't aware what happened, and I wake up today, and the doctor and my friend tell I am in coma for 10 days.
Okay, was it procedure? Did they tell you you went into seizure, or you just lost consciousness?
You mean convulsion, no convulsion?
Okay. Headache warning sign. Okay. What did it happen to you before? Did you enter a coma before?
No, it is the first time. I first time have a coma. It's the first time, and I have severe headache, and I go to a coma for 10 days.
Okay. Now, do you have any pain?
No headache, no pain.
So, did you lose consciousness after you entered the coma? Did you feel dizzy? Did you feel a headache?
I lost of conscious for 10 days.
Yes. After you were awakened, did you feel any headache upon sneezing or any visual changes?
You mean after recovery or before
Yes.
the coma?
After recovery.
After recovery, I'm normal.
Okay. So before you entered in the coma, have you vomited a lot?
I have nausea by no vomiting.
Okay. And any visual disturbance? Did you have any issues with your vision?
After recovery, no. But when I coma, I don't see anything.
Okay. Okay. Have you been treated for anything before? Do you have any current medical issues like diabetes or hypertension?
No. But still in this coma, especially in young, you need to ask about fever. Why you need to ask about fever?
Meningitis?
Okay, so you need to ask about fever. Okay, I have no fever, no diabetes, no hypertension.
Okay. Are you currently taking any medications?
I think the doctor gave me medication, but I don't know the name.
Okay. Have anybody in your family had this before?
No.
Okay.
You
I
ask
think
about fever for meningitis. What else you need to ask?
I think this is a Barrett's aneurysm. What
No,
else should
I
I?
mean, what else you need to ask?
Fever, alarming sign, increased intracranial pressure symptoms. I asked about the headache and vision changes.
What else?
What I don't know.
Trauma.
Oh yes, okay.
Any trauma. Okay. Well, anything else you need to ask?
Yeah. Do you have any issues in your belly? Do you have any pain in your belly?
Any? Say again. Any pain
Any
in my
pain?
abdomen?
Yeah,
You mean?
Yes.
No.
Okay. Have you ever been diagnosed with a kidney stone or a renal stone or?
No urinary problem.
Okay, I think I concluded my my history take.
You don't ask about social history, allergy, all these.
Oh, okay.
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 It is important. We don't need to reach the diagnosis. It's not the important. The important is how to fulfill the item of the history. So if you don't ask about, you ask about social history, or I forget.
No, I didn't.
You can ask.
Okay. What do you do for a living?
No, I am a student. I study engineering.
Okay. And with whom are you living with?
I live with my family.
Okay. Do you smoke?
Yes, I smoke 5 cigarettes per day for the last 5 years.
Okay. Do you drink alcohol?
Yes, I drink alcohol occasionally in the weekend.
Okay.
Allergy.
Yeah. Do you have any allergy to any medications or anything?
Allergic to seafood.
Okay.
Okay, so it is important, doctor, who is speaking? Muhammad Hisham?
Oh, yes.
This is attitude. It is easy to fail, Dr. Muhammad, because, you concentrate on the headache. It is okay. You concentrate on the condition, but if you forget to ask social history 1 mark, allergy 1 mark. What else? I forget. So this item is very important, and for a long time we have this problem with many candidate. So it is important to ask all item of the history. All right.
Okay.
I just review what is your diagnosis?
I think it's a subarachnoid hemorrhage perceived due to the young age, which can be.
Are you think or it is?
The most probable diagnosis is a subarachnoid hemorrhage due to Barry's aneurysm.
Barry aneurysm, okay, or AV malformation. All right, I just review what you mentioned. So if first, when we ask about headache and severe headache, you can ask about site, onset, warning sign, you ask about it, character. It is once you describe radiation, nausea, vomiting, you describe. Any fever, you forget to ask about fever. It's important to ask about fever. It's important to ask about trauma. Sometimes if you have congenital tumors or tumor like neuroblastoma or something, it can, but it's not common. You need to ask about, you forget to ask about any motor paralysis, any weakness, any paralysis. It is a stroke, not a stroke, just to exclude it is a stroke. So motor and sensory is important. It get worse because this is once, so no problem. After that, apart from this, trauma, visual disturbance you ask, loss of conscious you ask, sensitivity to light is important to ask, especially in meningitis, but this is not meningitis. Neck stiffness, you need to ask about neck stiffness. Any seizures you ask about other system. You ask about medical history, chronic disease, drug history, family history, social history, allergy. So what is the investigation you will do for this patient?
I will order a CT.
Yeah,
CT
doctor,
brain.
are you also working army or what?
No, I will ask for CT brain.
You know, we don't say orders. We ask for, it's okay. All right. So ask for CT brain. Okay. So
Yes.
this is the CT brain. You can see it. So what is usually most important, or what is the cause, is
Subarachnoid hemorrhage.
due to Barry
There is.
aneurysm. Okay. Other differential diagnosis: if patient have fever, can be meningitis, encephalitis, migraine, any increased intracranial tension due to brain tumor. This is other differential diagnosis, but the most common is subarachnoid hemorrhage due to Barry aneurysm. How to treat this condition?
I will start with the ABC protocol, and if the patient is compromised, and then with the CT we've ordered, I will make the بس أنا هسأل سؤال بس. The patient is now in an active condition ولا هو 10 days post؟
لا احنا مش بنسأل على البيشنت، احنا بنسأل how to treat this condition.
treat
يعني
subarachnoid
انت how to treat subarachnoid hemorrhage.
Okay. So first
احنا العيان is wake up or هو oriented now to take a history, but we speak about the patient in the past. So how to treat this condition if the patient have subarachnoid hemorrhage, how to treat?
Okay, first I will ensure an adequate airway and breathing, and ensure an IV access. I will order baseline the CT brain, and then full blood count and surgical panel, and keep the patient MBO for if there is an emergent neurosurgical procedure he will take, and then I will inform the neurosurgery.
So where you admit the patient? This patient under which care? If you see him in emergency, neurosurgery or under observation in neurosurgical units, and give some dehydration to decrease the intracranial pressure. And after settled, it is subarachnoid hemorrhage. What you will do in England, not in your country? In England, what we will do?
I will say burr hole and craniotomy, but
no, doctor, relax. What is my question? Just repeat my question.
Okay, what will you do in the UK? Not in.
I don't know where are you from, but what we will do in UK?
If it's a Barry aneurysm, the endovascular repair and the
no, it is not a repair, not repair, doctor. If you have any bleeding nowadays, so you make something called embolization. Embolization is inserted the coil, something like foreign material inside the feeding artery, so we called it embolization. It
Okay.
is like, for example, in the liver, if you have hemangioma and you need to resect it, so you make an angio, and the feeding vessels, you can embolize it, so you can shrinking the tumor. So we don't do bare hole, we don't do craniotomy. You agree?
Okay. Yes. Okay.
Oh, all right. Okay.
Thank you.
Okay. I just have another scenario is little related. It is the caesura. It is like I have convulsion. Okay. So I think Dr. What his name? Zahra, Muhammad Zahra.
موجود يا باشا. محمود.
Okay.
ازي
Mahmoud, أهلا بك. Okay. So this is patient. If you see the screen now or not? 55. I can share it again.
55-year-old suffered from لا دلوقتي
Okay, أنا عملتها تاني. 55 years old, suffer from severe headache, seizure, and convulsion, refer to neurosurgery unit in the hospital. So you can ask.
Okay.
Okay.
Hello, I am Dr. Mahmoud, one of the
Yes.
exam candidates. May I confirm your name and age, please?
I am Mr. Richard. I am 55 years old.
Nice to meet you, Mr. Richard. How can I help you today?
No, I just they refer me to your unit, neurosurgical unit, because I have some severe headache and convulsion.
Sorry to hear that. It seems a very stressful condition for you. But before we proceed any further, can I ask you some questions regarding your condition, if you don't mind?
Okay, can.
Before the seizures, do you feel anything different before?
You mean any warning sign? Yes,
Any warning?
sometimes I have see some lights and something like that.
Okay, great. Do you hear any unusual sounds before this episode?
No.
Any headaches or?
Yes, I have headache. I have headache. Yes.
Okay. During the episode.
No, if you need to ask about headache, the headache is in the occipital region and it's severe. Maybe the pain score is about 7.
Okay, sorry to hear that.
Okay. So if I give you item like headache so you need to analyze it.
Okay.
So I have occipital headache is occur frequent and severe pain about 7 out of 10.
Okay. should I analyze now? أنا ممكن أعمل analyze للهيدك بس أنا
up to you what you need to ask, you can do it. Up to you.
Okay. Regarding your headache, can you tell me the exact site of
it is it is in the back of my head.
Okay, it's present all the time or come and goes?
No, it is come and goes.
What increases your headache?
If just moving my head, with coughing even.
Okay. Is there anything to decrease relieve your headache?
Just I sleep.
Okay. If I give you a score from 1 to 10, 1 being the lowest and 10 being the highest, can please you score your
it is 7. It is 7 out of 10.
Okay. Sorry for that. Some questions regarding your seizures. Did anyone witness you while this episode?
Yes, sometimes my father notice me.
Okay. Do you feel anything while the episode? Is your body shaking?
You mean convulsion?
Convulsions?
Sometimes I have convulsion, yes.
Did you lose your consciousness?
Yes.
I'm sorry to hear that.
Okay.
Did you wet yourself?
No. What you mean by wet myself? What you mean?
Urination.
Yeah. So you don't have uncontrol for your urination?
Okay.
No.
Did you bite your tongue?
No.
Okay, great. After the episode, can I ask you some questions?
Yeah.
What is your feeling after this episode?
No, nothing. I just exhausted.
Okay, great. There is any numbness or weakness in any limb?
No, no
Uh,
muscle, no sensory loss.
Is there any affection in your speech or your eyes after the?
My speech, no, no visual disturbance.
Okay, thank you for sharing this information for me. Some questions, if you don't mind, regarding
Okay, can.
what about your health recently? Is there any unintentional weight loss recently?
No, no.
Okay, any vomiting?
Sometimes I have vomiting, yes.
Do you have any trauma to your head?
No,
Any fever?
no fever,
Any neck stiffness?
no neck stiffness.
Any sensitivity to light?
No.
Okay, some more questions regarding your health. Have you ever been diagnosed with any medical conditions like hypertension, diabetes mellitus?
No.
Okay, great. Do you take any regular medications?
No.
Do you have any allergies to food, to drugs?
No.
Have you ever been admitted to the hospital?
No.
Okay, have you had any surgeries before?
No.
Okay, some more personal questions, if you don't mind.
No problem.
Do you smoke?
Yes, I smoked 10 cigarettes for the last 20 years.
Do you drink alcohol?
Yeah, I drink 1 can of alcoholic beer every day.
Okay. Do you exercise?
Yeah, sometimes.
Okay, great. Regarding your social life, what is your job?
Yeah, I am a teacher. I teach English.
Okay. What do you with whom do you live?
With my wife and 2 children.
Okay, great. Thank you for this information. I will inform my consultant. And I will come back to you.
All right, thank you. Doctor, what's your name? I forget.
محمود زهرة يا باشا.
دكتور زهرة. انت الاول لما انت when you ask him about something I tell you I have some problem so you say great so don't say great.
دي لازمة عندي.
انت لا انت قلت great في حاجات if I say I have no hypertension no diabetes great okay but I tell you because sometimes in exam for example we tell you the patient have acute kidney injury. So some students say great or well, it is not professionally good. So you ask me after the attack what you have or what something like that. So you say great, it's not great. You tell a lot of story, maybe 4 times, but no problem. Of course, you ask about trauma. You ask about epileptic fit and visual disturbance. You are good ask about fever, stiffness, and the meningitis. So now, what is your diagnosis?
My diagnosis seizures. The patient has
This patient is 55 years old. So, and 55 years old. And they have like vague symptom of something in the brain. So what is the what is the investigation?
Brain tumor.
What is the investigation? Just tell me the investigation. What is the investigation?
General, first I will ask for general lab investigations.
Yes,
Like,
after that?
Okay. Investigate imaging for the brain.
Like what?
That was like CT.
Okay, so you need to be direct. No. First, okay. First, you need to be direct and don't give option. If you have a patient in your clinic, so you tell him we can do CT and the MRI, you can choose or just choose one.
MRI.
Okay, I think CT is easier, simple and safe. Okay, up to you, CT, MRI. So we show you the picture, this picture. So what is your diagnosis?
Brain tumor.
Brain tumor. Okay. Is this benign or malignant? Is a smooth surface, irregular surface, especially this one?
Well-defined border.
So most probably it is what?
You know,
What is meningioma? For example,
Meningioma,
can be
okay.
meningioma. Okay, so how to treat this patient? Just the first line of treatment. What is the first line of treatment?
Non-operative medications like steroids.
Steroid. Okay, so you can give to relieve edema, you can give a steroid or magnesium sulfate or dexamethasone. What else? If the patient has some convulsion, you can give phenytoin. Okay, of course, neurosurgery, and we have many options like stereotatic guide biopsy, surgery, whatever, no problem. Okay, so it is easy station. All these stations don't take a time. But again, because I think I prompted you to ask about other part of the history.
Okay.
Okay, so whatever the scenario, you don't concentrate in the main topics. You concentrate in other topics in the history taking.
Okay.
You got the idea? Because if you ask all the question in good way, but you forget to ask about again social history and all this, you become critical. دكتور احمد فتحي, you need to ask something.
بس الوقت تمام يا دكتور شيرين صح؟
الوقت تمام.
تمام ماشي.
بس if you forget to ask about other time of the history, you will be in critical situation. Okay, Dr. Ahmed Fathi, what you need to ask?
First, I need to participate in the next station. Second,
Okay.
I can ask in this station should be
Okay.
analyzed which one first, the seizure or headache?
No, up to you. No problem. The examiner have a checklist. What you analyze, we can do it. No problem.
But if I should focus, if I should focus on the one because I have no time for both.
No, you can just take it faster. No problem. It don't take a time, so you don't need to ask a lot. Just ask if you have convulsions, if you have how long it stay, and it is the same. So just simple question.
المقصد يعني ان انا ما اسالش في السيجر كتير وما اسالش في الهيدك كتير يعني اسال
يعني you are not neurosurgeon and you are not neurology and this is not medical exam, it is surgical exam. يعني هو زي ما زميلك سأل مثلا في المننجايتس fever, neck stiffness, that's rough. Convulsion, how long is stay, any visual disturbance, any aura or warning sign to exclude epileptic fit or something, so it's okay. Of course, epileptic fit not come in all the age. So this is just in simple way. Don't be expert. We don't supposed to are expert in this topic. We just bring this topic just to how to take a history. It is the station how to take a history, not how to take a history of convulsion or epilepsy. اوكي انا هخليك للي بعديها. بس هو في الدكتور اللي كان ابو فوده اعتقد هو كان عايز الظاهر بتاعنا على التونسلايتس دي او حاجه وعايز يشوف التونسلايتس. اوكي انت امتحنت فيها في التونسلايتس دي ولا لا؟
No, this is my first time.
Exam before? First time. So why you interested for this? You are ENT surgeon or what?
I'm a general surgeon.
Okay, so this is very common station, by the way.
Really?
Although it is not important to us as a surgeon, but it is 65 years old man, chronic smoker, presented with 2 months history of enlarged left tonsil, loss of weight, difficulty in swallow, cough with sputum, no fever, no night sweat. If you read it, and just I ask you in the script first before you ask me.
Mm-hmm.
Okay, so why we mention no night sweating?
To rule out TB.
Okay, because you know this exam is international and the majority is Indian and the Indian is interested in TB. In England, they're not interested for that. Okay, so if you can find, if you have no idea about this topic, but if you look into the scenario, you can ask a lot of questions and you can buzz the station. So I leave the scenario in front of you, so you can start.
Thank you, Dr. Shane. So I'm Dr. Ahmed Fouda, one of the surgical team, and I'm here to help you in your concern. Could I confirm your name and age?
Yeah, I am Mr. Richard. I'm 65 years old.
It's nice to meet you, Mr. Richard.
Okay.
What brought you here to the hospital today?
Oh, actually, for the last 2 months, I have swelling in my tonsil, left tonsil. I went to 4 doctors. Each of them described to me, some describe mouthwash and antibiotic. I take 4 types of antibiotic and not improved.
I see. I'm sorry for that. So
Thank you.
this is started 4 months ago. Yes.
No,
And
no, it is 2 months ago, and
2 months.
I go to 4 doctors.
I see. And how could you estimate the size of this
No,
mass?
I don't see it because it is inside my mouth, so I don't. It's difficult to estimate it.
Okay. Is it painful?
No pain, no pain at all. This is very strange because no pain at all.
No pain at all. At the same time, is there any difficulty in swallowing?
I have a little difficulty in swallow. Just for solid or big bulk of food, have difficulty to swallow.
Is it okay with fluids?
Yeah, fluid is okay.
Okay. Is that associated with the do you feel blood in your mouth or you spit blood?
No. I don't have blood, no sputum, just a little sputum with cough.
With cough. So you cough.
Yes.
Okay. How about your sleeping pattern? Is there any abnormalities while you sleep?
No, it's okay.
Have you vomited the blood before?
No vomiting of blood, no coughing of blood.
Have you noticed any other swellings in your neck or other side of your body?
I think I have another swelling in this area. Here.
Where exactly?
Yeah,
Where
and
exactly?
it is here. It's the left side, in the underneath the mandible, and it is painless.
And it is painless. Yes,
Yes.
I understand that. And do we have any fever, especially a night fever?
No fever, no night fever.
Have you noticed any other things in your tummy? Any
No.
other complaints in your tummy?
Think
Nothing.
like
Yes.
what? Like what?
Have you swelling or?
No.
Or
I am not a doctor. It's difficult to palpate my abdomen. Okay.
okay, okay, thank you. And have you lost any weight in the last?
Yeah, I lost 5 kilo in the last 1 month.
Do you lost your appetite at the same time?
No, I can eat, but I have loss of weight.
Okay. Do you have any problems with or you have any medical issues that you're taking medication for?
Like what?
Like diabetes, hypertension, cardiac disease?
No.
Have you ever had similar condition before?
Not, of course, no. Okay.
And
maybe when I was young, maybe have tonsillitis when I was a baby, maybe. Okay.
Yeah, I'm sorry for that. And have you admitted to any to the hospital any
No.
before?
No.
Have you had any surgeries before?
No.
Are you allergic to any drugs or food?
No.
Okay. Do you take any blood thinners?
No.
Could I ask you some personal questions if you don't mind?
Okay, can.
Do you smoke?
Yeah, I smoke cigarette. I smoke about 20, what's called 20 cigarettes per day for the last 20 years.
I see. And for alcohol, do you drink alcohol?
Yeah, I drink 1 can of alcoholic beer every day.
Okay. What about your diet?
No, I just eat normal diet, fast food, meat, burgers, everything.
Yeah, you prefer the fast food, yes?
No, I can eat everything, no problem.
Okay, and you exercise?
Sometimes.
Do you live alone or with your family?
With my wife.
Do any one of your family members had the same issue before?
No, but I think my father died from heart attack.
Sorry for that. And
okay.
If you have any other any other complaints otherwise in that you didn't mention, you can ask freely.
Okay, no.
Do you have any headaches, any diarrhea,
No headache,
any
no diarrhea.
difficulty in
Heartbeat,
micturition?
not worrying about my heartbeat, no difficulty in micturition. Okay. No
Thank you
joint
very much.
pain. Okay.
Yeah.
All
Thank you
right.
very much.
All right.
Thank
So
you.
I think you other system is have about 2 mark, by the way. So you need to ask other system like started from headache, shortening of breath, failure heartbeat, you have diarrhea, constipation, you have urine problem. So it is very important. Okay,
Yes.
so what's your diagnosis?
It's most likely a tonsillar tumor until proven otherwise.
Tonsillar tumor. Why you mention it is tonsillar tumor? You mean cancer, benign tumor, or malignant tumor?
It's most likely malignant tumor.
So it is malignant tumor. Okay, why you mentioned that?
For many reasons, because of the patient's age, history of smoking, the longest-standing or the longest-standing swelling that, in despite of antibiotic treatments, did not resolve, and there is another swelling in the neck, supposed to be cervical. Maybe cervical lymph nodes.
Okay, so why it is not tonsillitis and this is lymph node due to tonsillitis?
First, there is no fever, and
no fever. Okay,
there is
so
no
you mentioned
pain.
it is a cancer. What
Yes.
is the name of this cancer?
It's most likely adenocarcinoma.
No, adenocarcinoma not common tonsil. What is the lining epithelia of the tonsil?
The lining epithelia, it is. I can.
It is a squamous. I think so.
Squamous.
So it is not adeno. It is a squamous.
Squamous cell carcinoma.
Is any okay? It is squamous cell carcinoma. What other differential diagnosis can cause enlarged lymph node and what we call it and tonsil?
It may be lymphoma, Hodgkin or non-Hodgkin lymphoma.
Lymphoma. What else?
It could be also the
can
thyroid.
be viral infection. Can be not thyroid. Thyroid is other topics. Can be viral infection. Can be viral infection.
And it also could be, but with fever, it can be peritocellular or retropharyngeal abscess.
No, it is very rare. The common is lymphoma. What else? What is viral infection can cause enlarged lymph nodes and tonsil?
Epstein-Barr virus infection.
Epstein-Barr virus infection mononucleosis. Okay, Epstein-Barr virus diagnosed by agglutination test. So what is the investigation you will do for this patient?
It is important, firstly, to start with the basic line investigation, including the full blood count, liver function, and CRP.
What is the value of CRP?
It is an acute phase reactant that indicates that there is
in your practice, if every patient have infection like tonsillitis or cholecystitis, you do CRP and the ERCP and ESR.
It's
in
not
your
all
practice.
The case.
In your practice, if the patient have cholecystitis or appendicitis or tonsillitis, you do routine CRP and SRA, erythrocyte sedimentation rate, ESR.
Not for all cases. Not for all cases.
Okay, so it is not important. What else?
Next, I will do. It should have be rather than the surgical intervention or taking biopsy.
No, we're still in phase. No, just one by one.
Okay.
Was investigation. I think now you start to lose mark, doctor. Okay. We did biopsy for tonsil.
Yes.
Are you sure? If suppose it is malignant or even not malignant, you take a biopsy or remove it. What is easy?
Exactly. Is to remove it, excision.
To remove it. So forget biopsy. We don't take a biopsy. Biopsy is so dangerous. Can cause bleeding and can cause the spread of the tumor. So we excise it. So excision biopsy mean excise the whole tonsil and send it to histopathology examination. Okay.
I see.
Of course, other investigation is CT to see the lymph node, or sometimes you have PET scan and other.
Yes.
Okay, or sometimes the more specific is what is called the PET scan FDB, just to see is any tiny tumor and all this. Okay. We don't have biopsy. It is just a cancer tonsil. It is not important, but it's very common because this is don't take a time. Okay.
Yes.
Dr. Muhammad Ghunim, you need to ask anything or what?
I need to participate.
Okay, I think Dr.
Examification.
Gohari before you, so we start by Gohari and you, or Gohari finish, I don't know.
Yeah,
Sorry,
here,
sorry.
sorry.
So, Dr. Shan,
Can.
so Dr. Shan, how did you find my performance? Is too bad or need to improve?
No, it is okay. It's the problem is only management of time. If you
Yes.
manage the time proper, so it is okay. But you usually don't say something like, I take a biopsy or something. Or, of course, what happened usually, most of the students say we do CRP and the resource sedimentation rate, which actually in practice we don't do it.
Yes,
Okay.
of course.
All right.
Yes.
So
Thank you.
if you are logic to become easier, so it is easy to become logic.
Yes. I
اوكي
see. Thank you.
واحنا قلنا مين اللي هيتكلم؟ انا نسيت.
غنيم يا باشا مع حضرتك.
نعم.
غنيم مع حضرتك، وحضرتك قلت لي في حد قبلي او في حد معايا.
في دكتور خالد الجوهري بس انا مش لاقيه ولا موجود.
انا هنا دكتور.
اوكي all right اوكي. سو احنا فاضل لنا تو ستيشنز. تو ستيشن فيهم واحده جت بقى لها مده عماله تيجي. انا غيرتها النهارده لان هي كانت اصلا يورين ريتنشن، واحنا خلينا السيناريو like this in the last exam. And it is one of the big problem in exams. Usually the student remember what is coming the previous exam and speak like this. So 75 years old man complain of increased frequency of urination. Take a history, examiner ask you some question. Okay?
Can you repeat please, doctor? I'm sorry.
You see the screen or not?
No, it's not shared.
Okay, Asfina. Okay, so 75 years old, complain of increased frequency of urination.
Okay, so shall I start? Okay.
Yes, can.
Okay, hello, I'm Dr. Khaled on the surgical team. May I confirm your name and age, please?
Yeah, I am Mr. Richard. I'm 75 years old.
Hello, Mr. Richard. Nice to see you. First of all, can I ask you what brought you to the hospital today?
Yeah, I have increased frequency of the urinations. I wake up in evening maybe 3 times to go to washroom.
Okay, sorry to hear this, but I'll ask you some questions regarding this condition. Can you tell me when did this start?
It is about 3 months ago.
3 months ago. Is it getting worse or something?
Yes, it has become worse. So in the past, I more increased frequency in the daytime. Now I wake up in evening, maybe 3-4 times in the evening. I wake up, so it is interrupt my sleep.
Yes, so it's day and night. So sorry for this. Do you know what increased it?
No, I don't know. I don't know what increase, what decrease it.
Okay, so do you have this condition previously?
No, first time.
Okay, so do you feel like you have to rush to go to the toilet?
Yes, sometimes.
And do you feel like you did not complete your urination?
Yes.
And you wake at night to go to the loo, right?
Yes.
Okay, so do you go to the loo more often?
Yes.
Okay. Do you feel like you take more longer time to go to finish your urination?
You mean initiate my urination?
Initiation.
So I take a time to initiate my urination. Yes.
To initiate your okay, and
yes.
And do you have like any pain in your loin? In your
no, first in urination, no pain in urination.
No pain in urination. Nice. Okay. Do you have any back pain?
No, before back pain and all this, we need to ask about color of urine.
Yes. Sorry. So do you notice any change in your color of urine?
Yeah, sometimes I have red color, sometimes it's normal.
Okay. So
Sometimes is red. Okay. After that, you ask about pain. What you ask later?
do you have
Pain or
any
something?
do you have any pain in your tummy,
No.
especially in the back part?
What you mean by back part? My
Uh,
backbone or my
your lung,
back
like
muscle? No,
your
no,
lung. Okay,
no,
so and your back muscle, your back
no,
pain. Okay,
no.
do you
Oh, you
feel
mean back muscle or backbone?
backbone? Backbone, yes.
Okay, no,
So do you have any unintentional weight loss?
no,
About your appetite is okay?
yes,
Do you have any trauma to this part, to your
no,
pelvic part? Okay.
no,
Do you have any infection? Do you have any fever, like
no fever.
increased? No fever. Okay. So about do you have any headache or something?
No,
Chest pain?
no,
Increase your heart rate?
no.
Any weak lumps?
Any weakness? No,
Okay. So were you diagnosed by any medical condition like diabetes or hypertension?
no.
Do you have any regular drugs?
Black what? For hypertension, diabetes? No.
Any regular medication? Do you have any allergies from any medication or food?
Yeah, I actually for many years I work in dust because I was constructor worker. So I developed some sort of asthma, and the doctor described me a medication I give you in the paper. So you take the paper from the patient, and it is this evidrine.
This EVG.
Yes.
Okay, nice. And were you hospitalized before?
No.
Do you have any previous surgeries?
No.
Any one of your families have the same condition before?
No.
About your smoking habits, sorry for asking, do you smoke?
Yeah, I smoked a cigarette for the last 50 years.
50 years. And what about alcohol?
Yeah, I drink one can of alcoholic beer every day.
For how long?
For maybe 20 years also.
Okay, so about your exercise, do you exercise regularly?
No.
Do you eat healthy diet?
Yes.
Yes, so you told you work in dust, right? You are
In
you
the
are
past, yes.
yes. So what are you working right now?
No, I'm retired. I'm 75 years old.
Okay. So do you live alone or with someone else?
No, I live with my wife.
Okay. Do you have any stressful condition or something?
No.
Okay, so thank you, Mr. Richard.
Okay, thank you. Thank you. Okay. So before I start, why you ask about exercise? You and the previous candidate also ask about exercise. Is any relation between exercise and this condition?
Honestly, no, but I used
Okay.
to, I used to ask about.
Okay. So it is important in like ischemia, claudication pain, some medical condition. The same for stressful conditions, the life is stress. What's your diagnosis?
This patient is, as a patient is 75 years old age and smoker and drinking alcohol. He has some symptoms suggesting PBH, benign prostatic
What is
hyperplasia.
hyperplasia mean?
Increase in the size of the cell size of the prostate cells.
No, if it is increase in cell size, we call it hypertrophy. It is increase the number.
The
So
number.
it is It is precancerous condition or not?
It's no, it's not.
Not okay.
Yes.
So you ask about back pain or backbone pain, like vertebral column pain. Why?
Because the prostate, if prostate cancer, it's metastasized to the bones, so I have to
What
ask.
type of the cancer prostate secondaries? It is which type of secondaries? Is osteolytic, osteogenic?
It's osteogenic.
Osteogenic. So don't afraid from fracture.
Yes.
Okay. All
I
right.
felt
So
compression
how
sometimes.
how to treat this patient?
First, I'll give him a medical treatment like tamsuline, which is alpha blocker.
Alpha blocker and
finasteride.
what is finasteride?
It's like tamsuline also. It's,
No. It is not like tamsuline.
It's
5 reductase
5 alpha
inhibitor.
reductase inhibitor, yes.
5 alpha reductase inhibitor. Okay. So what is the difference? What is the side effect of the tamsuline?
Of tamsuline,
Something related to hypertension. What we call it?
hypotension.
Position,
Orthostatic
butcher
hypotension.
hypertension.
Orthostatic.
Position hypotension.
Position.
Position hypotension. Okay. So when you ask me, I give you a name of medication, something called ephedrine or disoephedrine. This is affect the condition or not?
honestly, I don't know what.
No, it is increased because this is alpha antagonist.
Agonist.
Agonist. So it is must be stopped.
Yes.
So if the patient takes something like asthma or something, those is alpha agonist is usually can be makes this condition worse. So it is better to stop it totally. And after that, we start by either position hypotension by tamsuline, alpha blocker. But if the patient is travel, suppose the patient is have a businessman and travel to many countries, so it is better to don't give alpha blocker, give 5-reductase alpha inhibitor. Okay,
Yes.
so it is just a benign prostatic hyperplasia. Okay, it is very common station. Okay, I just tell you at the end what happened in the station, so we can speak later. All right.
So, Doctor, may I ask a question? How can you rate me in history taking and discussion?
No, it is okay. Usually, is no much difference between the student in the exam at all. All the students are copy and paste, are the same. Okay, is an only how to manage the time and how to avoid unnecessary question. It is okay. Apart from
so
this, but it is important as we started. We evaluate you by way of sitting and your stress and other that.
So how would you find? How did you find?
No, I don't see your position, but I will speak after finish. We can speak about position again, like your attitude, your movement, and all this.
Okay, thank you.
Okay, so I think Dr. Ghanem, you need to speak about it. I think what you have is
Haematuria.
still in hematuria also. Yes.
Yes.
Okay. So I just you see the screen or I need to share?
Yes, I see it.
You see it. Okay. So this is 75 years old man, ex-worker in dye factory, complain of hematuria, admitted yesterday, urinary catheter was inserted. Okay. So before we start, why we insert urinary catheter?
If the patient have obstruction?
No, it is have no retention. It is not a case of retention of urine. So why we put a catheter? Because this is have a bleeding. Hematuria, so can be have blood clots. So this blood clots can obstruct the pathway. So to avoid obstructions, we make catheter, triple Foley or three-way catheter to irrigate the bladder. So you can start now. Okay.
Hello, my name is Dr. Muhammad. I am one of the exam candidates for today.
Yes.
Can you confirm your name and age for me, please?
I am Mr. Richard. I'm 75 years old.
Hello, Mr. Richard. Nice to meet you.
Yes.
How can I help you? How can I help you today?
No,
Mr.
actually, I found my urine has become red in color.
Okay. When did you start noticing that, Mr. Richard?
Just yesterday.
Okay. How many times it happened?
No, it is all the yesterday. It is red.
Okay. Is it getting worse?
What you mean by getting worse? Increase the number or what? If the bleeding is getting worse, become blood clots. Yes. So no blood clots. No this blood is not a pain because I found many of you ask about it is getting worse, what increase, what decrease. This is for pain, but not for hematuria and not for the other. But if you need to ask it is worse or not worse, just ask about it is have any blood clots. So if the patient have blood clot, it means that it is a lot of bleeding. Okay, what else?
Regarding the blood, is it present at the start of the stream or at the end? Or
this is good question. It is initial or terminal? Okay, yes. It is terminal at the end of the micturition.
Okay. Is there any pain associated with this bleeding?
No pain at all.
Okay. Have you had any trouble with your urination before?
Like what?
Any similar episodes? Any similar episodes in the past?
No, first time.
Okay. How has your health been recently? Are you feeling well?
No, you finish all urinary symptom or not?
Yes, I finished analyzing the bleeding. You said
Yes,
that
but
there
you need to
are
ask
no.
about other urinary receptor like dysuria,
Yes,
all this you ask.
I'm going to
Yes,
ask
you
about.
ask.
I'm going to ask about it. Yes.
All right, okay. So what else you need to ask?
I was asking about, are you feeling well in how يعني about your health being recently? Are you feeling well?
Yeah, I'm okay.
Have you noticed any unintentional weight loss?
Yeah, I lost 5 kilos the last month.
Have any back pain?
You mean what you mean back in which part of my back?
Your lower back, any
You
back
mean the
pain?
backbone in the bone of
Backbone,
my
in your backbone.
no,
Okay. Have you had any fevers?
no fever.
Okay. You have any burning sensation when urinating?
No,
Any loin pain?
no,
Do you have to rush to the toilet recently?
no,
Okay. Do you go more often to the toilet?
no.
You have to wake at night to go to the toilet?
No increase in frequency at all.
Okay. Does it take you longer to empty your bladder?
You mean initiate bacteriation? No.
Okay.
Or weak
Okay.
stream or all this? No.
Okay. Have you had any trauma to
No
that area?
trauma. No trauma.
Okay. Have you noticed any bleeding anywhere else in your body?
No.
Okay. Were you diagnosed with any medical condition like hypertension, diabetes, asthma,
No.
any bleeding disorder?
No.
You take any blood thinners?
No.
Okay. You have any allergies for food or drugs?
No.
Have you been ever admitted to hospital, get catheter, like a catheter or
No.
any instrumentation in this area?
No.
Have you had any surgeries in the past?
No surgery.
Any one of your family has had this condition before?
No.
Okay, Mr. Richard, I need to ask you some personal questions. You smoke?
Yeah. Yeah, I smoked 10 cigarettes for the last 50 years, every day.
Okay, you drink alcohol?
Yes, I drink 1 can of alcoholic beer every day for last 20 years.
Okay, what about your food? You eat any beetroots?
What does beetroot mean?
Um, okay, you take طب
You
بيتروت اللي
mean
هو بالعربي يعني؟
بالعربي or in
اللي هو
English?
البنجر يعني. الانجليش مش
Oh,
هقدر
okay.
اقول.
You mean that it is something makes the urine
يس
okay.
يعني دراجز ريفامبيسين وفي الاكل البنجر والحاجات دي بتخلي اليورين ريد جدا.
We have a dragon in Southeast Asia. We have dragon fruits. Red dragon can cause the urine. Okay. Is this important to ask this question?
I think yes.
Okay, no problem. So I don't eat beetroot. Okay. All right.
Okay. What do you do for a living, Mr. Richard?
I am a retired worker. I work in dye industry for making dye for painting.
Okay. Who do you have at home with you?
No, it's with my wife.
Okay, Mr. Richard. Okay, so you can to summarize what you complained yesterday from haematuria or bleeding in your urine.
Terminal haematuria, yes. Yes.
Okay. And you noticed the unintentional weight loss for 5 kilos in the last month, and you don't have any fever and any change in your
Okay.
urine.
So, doctor, when you ask about it is initial or terminal hematuria. Suppose it is initial hematuria, what it means?
Means like a stone. Is this stone?
No. What is the difference between initial and terminal hematuria? Beginning and the end. Initial, it is the cause is which part of urinary system?
Okay. Initial, it's in the kidney, in
Urethra.
the upper.
Usually urethra.
Initial in
Initial
the
is
urethra.
urethra. Urethra can be
Urethra.
painful, can be
Okay.
painless, and terminal usually urinary bladder or kidney. All
Yes,
right.
yes.
Okay. So, what's your diagnosis?
Okay. My provisional diagnosis will be bladder cancer as the patient is old
What
age,
is
is
the name
heavy
of bladder
smoker.
cancer? What is the name of this bladder
Transitional
cancer?
cell carcinoma as the patient used to work in a factory, in a dye factory.
Okay. All right. So, by the way, we have this scenario many times. So it is transitional because squamous cell carcinoma occur in bilharziosis, so it is not common all over the world, even now not in Egypt. So when you read the scenario first, doctor, what you expected the diagnosis?
I expected that it's a bladder cancer, it's a transitional cell
Okay, so
carcinoma.
why you ask about beetroot and the tetracycline and the other? Okay, so don't ask unnecessary question. How to investigate this patient? What is the investigation?
Okay, I will do a urinary dipstick to confirm the haematuria, assess infection. I will send the sample for cytology. I will do blood tests like full blood count, urea and electrolytes. I also do a clotting screen, PSA, to exclude
PSA for what?
to exclude any prostate
Prostate. Okay, so you
prostatitis or
can
prostate
exclude
cancer.
prostate. Also, the patient have no retention or all this, but can also. What else?
Okay, for the real bladder, I can do ultrasound, I can and CT.
I think ultrasound not of value. Maybe cystoscope is better. CT to
Cystoscope and
exclude any invasion or something like that. So suppose it is superficial tumor, being superficial to the muscle. How to treat it?
Superficial
Something
only.
superficial means superficial to the superficial muscle because the urinary bladder have superficial and deep muscle. So if it is superficial lesion, how to treat it?
Transurethral resection of the bladder
Okay, so
tumor.
just to remove, you can make local resection. So it is something unique in the urinary bladder. In urinary bladder and the semen focal cord, you can remove the superficial tumor. But suppose you have the same like ulcer or malignant ulcer in colon, we don't remove it, we remove the whole part of the colon. So if it is superficial, you can excise through the cystoscope or transurethral resection of the tumor. How to give a chemotherapy for this patient?
Installation of the chemotherapy
Through the catheter. So also they have local chemotherapy and even immunostimulant by BCG can giving through the catheter. So superficial tumor, urinary bladder have some unique, not in other tumor. You can local excise, you can remove it, you can give local chemo, you can give local immunostimulant. Okay. Of course, it is transitional cell carcinoma. All right. Thank you. I just tell my comments. I just stop recording and tell my comments. I have this station. I just came from Sri Lanka.